Right, I'm washing my hands and putting on the proper PPE equipment. Hi, Mr. Hicks. I'm Sarah. I'm your student nurse today with Macomb Community College. I'm going to be doing your physical examination. It should take about 20 minutes. It's going to involve me touching your head, arms, legs, abdomen, chest, and back. Is that okay with you?
Yes.
Excellent. All right, I'm going to close this curtain to ensure some privacy. I'm going to verify your wristband. Can you state your name for me?
Dennis Hicks,
And the date of your birth.
7/16/93.
All right, and everything matches up. I'm going to start off by asking you some orientation questions. Do you know where you're at?
The hospital.
Do you know why you're here?
The assessment.
And do you know what day of the week it is?
Sunday.
And can you state your name one more time?
Dennis.
Patient's orientation is times 4. Patient's posture is upright. He is well groomed. He is neat. His skin is consistent with his ethnicity. There's no visible lesions or scars. His mood is calm and relaxed. His gait is stable and unaided. Looking at patient's head, it is symmetric and it is round. Hair is evenly distributed and it's brown. Looking at patient's facial expressions and bony structures, they are intact. They are appropriate size for his age. They're without lesions or bumps or deformities. I'm going to go ahead and have you take your glasses off for a few minutes. Thank you so much. I'm going to go ahead and check you for any pain or tenderness. Any pain or tenderness?
No.
All right. Patient's scalp is hard and smooth. Hair is clean, hair is clean, dry, and smooth. I'm going to go ahead and check for any pain or tenderness in your face. Any pain or tenderness?
No.
All right. There's no pain or tenderness. There's no lesions or scars. Facial skin and bones are intact and symmetric. There's no deformities. I'm going to go ahead and test some of your cranial nerves. So what I'm going to have you do is smile for me and clench your teeth, stick out your tongue, puff out your cheeks, right through your forehead, and close your eyes tightly. Excellent. Cranial nerves 3, 5, 7, and 12 are all intact. I'm going to go ahead and touch you with this cotton ball. I'll have you close your eyes, and I just want you to point to where I touch you, okay? All right. Patient responds to light touch sensation, and he'll note the location. I'm going to go ahead and check your sinuses. Any pain or tenderness?
No.
All right. Patient has no pain or tenderness in his sinuses. Looking at patient's eyebrows and eyelashes, hair is evenly distributed and symmetric. Patient can easily open and close his eyes. Skin underneath is intact. Patient's sclera is white and clear. Can you go like this for me? Patient's conjunctiva is pink and without swelling. You can let go now. All right, I'm going to have you look straight ahead for me. Looking at patient's iris, it is about 5 millimeters. It is round, even colored, and hazel. And just look straight ahead again. All right. Patient's pupils are constrict, and the reaction is consensual. I'm going to go ahead and have you follow my pen with your eyes. All right. Patient's accommodation is intact with Perla. All right. I'm going to have you follow with your eyes, looking at my pen without moving your head, okay? All right. Patient has smooth and coordinated movements in all 6 directions. I'm going to have you close one of your eyes for me and tell me how many fingers I'm holding up.
2, 1, 2.
And the other side.
2, 3, 1.
Excellent. And I'm going to have you close one of your eyes for me and tell me when you see my fingers.
I see them.
Excellent.
I see them.
Excellent. Patient's near vision is intact, peripheral vision is intact, and you see my fingers at the same time as I did. Looking at patient's ears, they are symmetric, they are intact, and the skin is consistent with his ethnicity. They are symmetrical, earlobes are attached. Looking in the patient's external acoustic canal, there's no discharge or lesions. The skin underneath the lymph nodes have no red streaks, edemas, or arrhythmias. I'm going to go ahead and check any pain or tenderness in your lymph nodes. Any pain or no lymph nodes are non-palpable and non-tender. I'm going to go ahead and check her ears. Any pain or tenderness?
No.
Right. Patient reports no pain or tenderness. There's no edema. There's no nodules. Close your eyes and just let me know when you hear my fingers rubbing together.
I hear it.
Right. Patient's acoustic nerve is intact. Right. I'm going to go ahead and look at your nose. Patient's nose is midline symmetric, and the septum is midline and symmetric. Skin is consistent with his ethnicity. I'm going to go ahead and have you close one of your nostrils, take a deep breath in and out. Another side. Patient's patency is good. I'm going to have you look up. Patient's turbinates are pink, and there's no nasal discharge. I am looking at patient's lips. Patient's lips are smooth, pink, and moist. I'm going to have you open up your mouth. Patient's buccal mucosa and gums are pink and intact. Anterior posterior pillars are intact and pink. Hard and soft palates are intact and pink. Patient's tonsils are absent. Patient's teeth are appropriate mount, and they are white, symmetric, and there's good oral hygiene. There's no abnormal odor. The uvula is midline symmetric. Can you say ah? It goes up. There's no redness in the back of the throat or the uvula. All right, I'm going to have you stick your tongue up for me and move it up, down, side to side. All right, patient's tongue has good range of motion, smooth and coordinated. Patient's tongue is pink, rough, and moist. All right, I am going to go ahead and have you push against my head, or my hand and the other one. All right, and try to check your shoulders. All right, patient has adequate strength, full resistance to opposition. I'm going to go ahead and check your jaw. Can you open your mouth to me and close it, and then open it to the left and to the right. All right, any pain or tenderness? Right, there's no crepiness and there's no swelling, and patient can fully open and close their mouth. Looking at patient's neck, the trachea, the thyroid, and the neck are appropriate size. There is symmetric and midline. There's no nodules, masses, or lesions. I'm going to go ahead and check to make sure your trachea is midline. Right, trachea is midline. I'm going to go ahead and have you look up to the ceiling for me, and down to your chest, and to the left, and to the right. Right, patient's neck, it has good movement. All movements are smooth and coordinated and symmetric. Right, I'm going to have you put your arms out like this for me. Right. Patient's skin is consistent with his ethnicity. There's no visible lesions or scars. Hair is evenly distributed. Let me know if you experience any pain or tenderness. Any pain or tenderness?
No.
Patient's temperature is warm. I'm going to go ahead and check your brachial pulse. +2 equal bilaterally. Radial pulse is +2 equal bilaterally. Carotid pulse is +2 equal bilaterally. I'm going to have you put your arms out again for me. Thank you. I'm just going to, any pain or tenderness?
No.
All right, patient's epitracheal lymph nodes are non-palpable and non-tender. I'm going to have you flip your hands over for me. Patient's hands are moist and warm. Skin is consistent with his ethnicity. There's no visible lesions or scars. Looking at patient's nails, they are flat, round, thick, and clean. Capillary refill is under 2 seconds. Can you go like this for me? Patient has no signs of clumping. All right, and I'm just going to go ahead and have you put your arms like this. All right, and don't let me push them. Don't let me pull them. And grab my fingers tightly. Okay. Patient has adequate strength against patient has adequate strength against with resistance to opposition. All right, I'm going to check your back now. Oh, you are more than welcome to put your glasses back on. And lift your shirt. Thank you. Okay, Patient's skin is consistent with his ethnicity. There's no visible lesions or scars. His muscular development is appropriate for his age. Scapula is equal bilaterally, and the spinous process is midline. Posture is upright. His respiratory rate is even, unlabored, at a rate of about 15 beats per minute. I'm going to go ahead and have you take a deep breath in. Thoracic expansion is equal bilaterally. I'm going to go ahead and check your kidneys. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Alright, there's no masses or bulges indicated, and the thoracic is symmetric and equal bilaterally. I'm going to go ahead and put my hands on your back. When you feel my hands on your back, say 99.
99, 99, 99, 99, 99.
Patient's tactile fermentus is equal bilaterally. I'm going to go ahead and listen to your breath sounds. Take a deep breath in and out. I'm going to have you put your hands up. Deep breaths in and out. Alright, patient's breath sounds are clear to auscultation. I'm going to have you turn it back around. Looking at patient's chest, his skin is appropriate with his ethnicity. There's no visible lesions or scars. There's no heaving or pulsations or his pericardium. There's no veins or any movements present. I'm going to go ahead and check you for tactile fermentus. Just say 99.
99, 99, 99, 99.
Tactile fermentus is equal bilaterally. I'm going to go ahead and listen to your breath sounds. Deep breath in and out. Breath sounds are clear to auscultation. Looking at them, his posture is upright. They are even, unlabored, and at about a rate of 15 beats per minute. I'm going to go ahead and listen to your heart sounds. Heart sounds are regular. S1 and S2 are detected. No other heart sounds are detected, and there's no sign of murmurs. If I can have you lay down, I'm going to look at your stomach. Patient's stomach. The skin is consistent with his ethnicity. Hair is evenly distributed. There's no visible lesions or scars. There's no pulsations, movements, or veins. There's no bulges indicated, and the umbilical is midline. I'm going to go ahead and have you raise up like you're going to sit up and back down. He has adequate muscle strength, and there's no signs of bulges or an umbilical hernia. I'm going to go ahead and listen to your bowel sounds now. Your contour is also flat. Bowel sounds present in all 4 quadrants. And there's no sign of breweries. And go ahead and check for any pain or tenderness. Any pain or tenderness?
No.
Right, and there's no masses or bulges indicated. At this time, I'm going to check his inguinal lymph nodes and his femoral pulse. Looking at his legs, the skin is consistent with his ethnicity. There's no veins, there's no visible lesions or scars or abnormalities. Hair is evenly distributed. I'm gonna go ahead and check for any pain or tenderness. Any pain or tenderness?
No.
Temperature is warm. I'm gonna check for pit and edema. No signs in pit and edema in either leg. I'm gonna go ahead and check capillary refill. Capillary refill is less than 2 seconds in both toes. Posterior tibial pulse is +2 equal bilaterally. Dorsalis pedis pulse is +2 equal bilaterally. I'm going to go ahead and check some of your range of motion. I'm just going to raise your leg up and extend it out. Perfect. And again. And extend it out. I'm going to have you push like you're pushing the gas. And again. Alright, patient has adequate muscle strength, equal bilaterally. I'm going to go ahead and have you sit up now. Thank you. I'm just going to have you try to dangle your legs as best you can. I'm just going to check your deep tendon reflex. Alright, patient's quadriceps contract and legs extend equal bilaterally. I'm going to have you stand up and take a couple steps towards me, and then you can turn back around. Patient's gait is stable and unaided. You can sit down. Stable and unaided, all of his movements throughout the examination were smooth, controlled, and symmetrical. I'm going to have you touch each one of your fingers to your thumb as fast as you can. All right, patient can touch, you can stop now. Patient can touch each finger to their thumb rapidly, coordinated, symmetrically, at an adequate rate. I'm going to go ahead and have you stand up one more time. I'm going to have you close your eyes and stand on one foot. Okay, and then the other one. Excellent. You can sit back down. Patient can maintain that position for longer than 5 seconds, equal bilaterally. Do you have any questions for me?
No.
Okay, then your examination is complete, and thank you for coming and have a great day. I'm going to wash my hands before exiting the room.